Hi, good morning. I'm Dr. Michael Richman, double board certified cardiothoracic surgeon. So I've discussed many different aspects of cancer, including diagnosis and treatment of different types, previous videos, and the importance of getting next-gen sequencing of approximately 27 different types of cancerous tumors to guide therapy. Today I want to talk about something related to breast cancer called Oncotype DX. So what is it? Well, it's a 21 gene expression assay used in HR positive, that's hormone receptor positive, HER2 negative, early breast cancer to predict the risk of recurrence after treatment and guide adjuvant chemotherapy decisions. That means after the definitive treatment. The test is FDA cleared, not FDA approved in the traditional sense, but cleared as a laboratory developed test and is the preferred assay by the National Comprehensive Cancer Network for both prognosis and the prediction of chemotherapy benefit in both men and women with early breast cancer, who I highlighted, because men get breast cancer. What are the indications for use? So it should be used in patients with HR positive, HER2 negative breast cancer in the following settings. First, for lymph node negative, which is N0 disease, the test should be done for both premenopausal and postmenopausal patients who are candidates for chemotherapy. For node positive patients, in patients who have 1 to 3 positive nodes, the test should be done in postmenopausal patients and considered recommended for premenopausal patients. The test should not be used in patients with 4 or more positive lymph nodes because there's insufficient data from clinical trials in this population, and chemotherapy decisions should be based on clinical factors, not this test. It's not helpful. So it's the only multi-gene assay validated in clinical trials to predict chemotherapy benefit in addition to providing prognostic information. And this evidence is supported by 2 landmark prospective trials. The first one's the TAILOR-RX trial, TAILORX trial, and the RX-Ponder trial, okay, RX-PONDER trial. The details are beyond the scope of this video, but I encourage you to look them up if you're interested because they're, like I said, landmark trials. Traditional sensitivity, which is the true positive of a test, and specificity is identifying the true negative metrics, are not reported for Oncotype DX because it provides a continuous risk score between 0 and 100 rather than basically a number diagnostic result. Instead, the test performance is characterized by its prognostic accuracy and predictive value for chemotherapy benefit. So what's the conclusion? So this test is currently the standard of care and is in all major international treatment guidelines. The National Comprehensive Care Network designates it as the preferred assay for node-negative disease and postmenopausal node-positive disease. The American Society of Clinical Oncologists, or ASCO, also strongly recommends its use in these populations. Real-world data, and that's key, demonstrate Oncotype DX testing reduces chemotherapy use by 12 to 75% in appropriate patient populations, avoiding unnecessary treatment and associated toxicities. And I know many of you talk negative about chemotherapy and treatments. Well, here we got a test that tells you, not perfectly, but pretty decently, is if based on the tumor characteristics, if it'll be beneficial. So with that, hope you learned something today. Thank you so much for listening. For more information, guidance, advocacy, or a consultation by me, you can go to my website, www.paladinmds.com, and have a great day.